So what's next? It's the new year, Medicare 2025. What's next? What are the Medicare essentials starting the new year right? So it's definitely a sigh of relief for both the agent and clients. It was a really crazy annual enrollment period because there was tons of changes, particularly the Inflation Reduction Act. So if you haven't heard of the Inflation Reduction Act, it was a measure which really this year focused on the $2,000 cap on prescription drugs that are covered. So definitely there was a lot of pros and cons to the act, just because now the most a Medicare recipient would pay if they had a drug plan is $2,000. Keep in mind, in 2024, it was $8,000. So it's great for seniors that were stuck in that donut hole. So that donut hole, if you don't recall or don't know, is when clients actually were tallying up their totals, and at a certain point, you would have to pay 25% of drug costs, which actually costs a lot more. And then your drugs did cap to 8,000. Now for next year, it's 2,000. So the drug tiers could have changed. There's tier 1, which is your preferred generic, your tier 2, which are your generics, your tier 3 are your preferred brands. And then you have the tier 4s, tier 5s, tier 6s. So there was a lot of formulary. So what is a formulary? It's basically what an insurance company are covering for your drugs. There is a deductible in 2025 of $590. And there were drug premium increases if you do have a standalone drug plan. So what do you do now? You change your plan, everything's good. Please make sure, if you do have a plan that is the HMO plans, that you do check your identification card, health ID card, with the correct doctor and medical group. Sometimes clients don't check until they get into the doctor's office. So when you're at your doctor's office, they see that it's not the correct doctor, not the correct medical group, sometimes because your doctor could take multiple medical groups. Then either you, the client, will get turned away, or they will ask for a cash upfront, or you can get reimbursed, but it may also be a hassle of doing that. So first off, please make sure your health ID card is correct. Even correct plan. There are times when it's already happened and it's only the 6th of the month that a client didn't know their plan got switched without their authorization. So be careful on that. Get ready for the barrage of phone calls again from call centers. Remember, you cannot get a cold call to switch your Medicare Advantage plan. You should have either requested information to get a call. So when you see these Facebook ads or internet ads, or even postcards that look really official, like it comes from Social Security or the government, it's a marketing advertisement. You are going to get a barrage of 5-10 calls a day. And I'm sure in the annual enrollment period, you were. And if you're lucky not to, great. You were never put on those lists. You never clicked on something on the internet. So please, I would caution, don't give your info over the phone, because once you give your info, that person on the other line sometimes could look up your information, change your plan without your knowledge. So there are definitely some plan benefit changes for next year. So what are the top ones that I've encountered? The top ones is, what's the flex card? I get all these commercials, I hear all these ads on TV, what is the flex card? Typically, a flex card has like your dental, vision, hearing, credit on there. So some people tell me, well, Jennifer, they said I could get $5,000 in a credit card, right? Usually those are over exaggerated, meaning you might get something, but it's not going to be that 5 or 10, 15, 20,000 that it's promised to you on the TV. It's more of a come on for you to actually give them a call. And you know what they're going to say? They're going to say, sorry, based on your zip code, you don't qualify. So be careful of those unscrupulous agents and call centers, even call centers overseas. It's just, as years go by, there are more call centers out there that are very unethical. So be very careful and mindful of those type of situations. I have clients that they just wanted to hear, what the person on the other line was offering, didn't do anything, didn't want to do anything, said, sorry, I'm not doing anything. And guess what? 2 weeks later, they get a new ID card with a different company, which they didn't authorize. So Center of Medicare Services is definitely cracking down on it, but these unscrupulous call centers, these unethical agents, they're still doing it. Be it not getting caught, I don't know, but it is out there, and it's very unfortunate for the senior to be, the grunt work of these unethical people. Okay, so those dental, vision, hearing cards, yes, it could be true, but they're over exaggerated, and they'll say, oh, sorry, you don't have it in your zip code. Oftentimes now too, with the different perks on these plans, such as like the grocery card, the different supermarkets, they're all different, varying per plan. Some do not roll over, meaning you will not be able to use your credit for the following month. You probably have heard about the utility card, even gas, pay your cell phone. But the biggest thing for 2025 is some of those qualifications are either if you have Medicaid or have chronic conditions that are verifiable. So those are the things that I've seen for this year that has big changes. And some clients are not aware, the Medicare recipient is not aware because the carrier didn't really notify them that their benefits are changing. So keep that in mind too, because you just don't want to be in a spot where you thought you had something and it was taken away. I've also had instances where clients are crying. They get these calls from other agents saying they have no coverage. So these seniors or clients are actually panicking and signing up, where some of the things that are just so untrue just to make a sale, which is very unfortunate. Seniors are also guilted in moving in plans, which I've heard. I had an agent where her client was crying because she moved to a better plan, but that call center agent said, why did you move? I can't believe you did this to me. So don't, please, if that happens to a loved one, to yourself, I would report that, because that's just very unethical and that's not supposed to happen. I've even had instances where the call says it's from Social Security, which is not true. Social Security is not going to call you unless you made an appointment with them or you are applying for Part A and B and they had to call you. But other than that, they're not going to call you yearly. They're not going to ask for all your information. And there's just so many scams on that. So I just really suggest keeping your local agent. There's just so much barrage of scams going on. I've even had where they say I'm from Jennifer's office, and they even mention my name, the current plan they're on, which is crazy, because how do these other agents get this information, right? So I would say be very mindful and careful of what you put out in the internet or information that you provide on the phone. I would definitely just hang up. There are too many times clients get intimidated to change their plan, their doctors. There's a lot of scare tactics in regards to, your plan is terminated, your doctors change, your groups change. So be careful on that. Yes, of course, in 2024, there were a lot of plan changes. There were a lot of doctors and groups negotiating with carrier contracts. And unfortunately, some of that was even during mid-year where clients were very uneasy. They needed to make sure that they were on the right plan to get their doctors and keep their doctors in their medical group. So I would just not entertain those call centers from overseas, be very reluctant to taking those calls. But let's just say you didn't make any choice. You lost some benefits that you may not have known you lost. You figure out your drug prices are too high. Some drugs I've seen go from a tier 3 to a tier 4 or not even covered on the formulary. There is actually a time for you to make a change. So we just finished the annual enrollment period, which is from October 7th to, sorry, not October 7th, October 15th to December 7th. That was actually my husband's birthday. So October 15th to December 7th, you actually could make a change for the annual enrollment period. Actually, from October 1st to October 14th, you can talk about your plans, but you cannot make a change. So let's just say you passed the December 7th cutoff, you did not make a change, you made the wrong decision. Not to worry, you can still make another change from from January 1st to March 31st. That is called your open enrollment period. And agents are not supposed to call you or market to you. However, you could call knowing that you can make a one more time change between January 1st to March 31st. And that is called open enrollment period. Most people may not know about that. I just had a doctor's office client call me. He was really skeptical to make a change. His wife's like, no, you can't make another change. It's only 1 year, but it's not. You do have that open enrollment period, as mentioned, from January 1st to March 31st. So, like I mentioned, there were so many carrier insurance companies, contract changes, was not even during enrollment. So you need to really make sure on your plan that you are with the right doctor, if you really have a particular doctor in mind, that all the specialists in that doctor group that your doctor is in is aligned with your doctor. I've seen that a lot where a senior would like that doctor and has, say, maybe 5 specialists, but sometimes they don't align. And really, unless the medical group gives you an exception to see a doctor out of the network or out of the group, it's probably not going to happen. So it's really good to make sure that they align. And I'm telling you, if you go to like Medicare.gov or other company websites, it's very hard to navigate. It's not easy to navigate through that. That's why local insurance agents definitely could help you with that. You need to make sure that the urgent cares you go to are the ones you want to go to, and then that they align with your medical group. Usually the medical group will dictate who you're going to go to. And then the hospitals are the biggest thing as well, because you want to go to the hospitals that are more reputable, have better service. Not all hospitals are the same. So you want to make sure they're very close. some people do ask me, well, Jennifer, if I'm outside of the state, am I still covered? Yes, of course, for hospital and urgent care for an emergency, you are covered. And usually you'll be taken to the nearest hospital through the ambulance, unless you're particular and you say, I want to go to X hospital. So keep that in mind. The switching of plans is also very important, making sure that you are giving permission or authority to agents to do this, because I've already come across this through me and my agents. First of the year, they go to their doctor, they think they're on one plan, and the doctor says no. The card doesn't even show my name or the medical group. So that's very important. And sometimes it's not even the agent's fault. Sometimes we do put in the doctor specified, and systematically, for some reason, the systems change it automatically. So that's something to also keep in mind. Did talk about open enrollment period. There are special enrollment periods as well. Special enrollment periods are not AEP, which is annual, not the open enrollment. It's special enrollments, and where, let's just say you quit your work, you lost coverage from that, you retired, you turned 65. Those are also if your spouse did quit work or retire and then you are in their plan, that also warrants for special enrollments. Another big special enrollment is, let's just say you moved counties, that can occur. Also, weather-related instances. So sometimes in your county, there might be weather-related causes like a fire or a storm or tornado, earthquake, something like that, that you weren't able to enroll in a plan because of that disaster, and you're able to make another enrollment period on that as well. So keep that in mind. So I don't want to confuse you in regards to a Medicare supplement versus a Medicare Advantage. This was more geared to Medicare Advantage plans, because a Medicare supplement, you could go actually anywhere where Medicare is accepted. So for this episode, we are focusing more on benefits. So now that you might be on the right plan or have the plan, making sure that all your drugs are covered, that your drug cost is not very high, because there are differences between plan to plan on coverage and cost. Now, what in regards to your benefits, now that we made sure that your ID card is right, your doctor, your medical group, your specialists know that you're on a new plan, or if you've kept the existing, what now? Definitely want to make sure that you are receiving all your benefits. You did pay all your life to Medicare, so make sure that you are utilizing all your benefits. And it is not that easy, even for me, to navigate through it as just an individual who doesn't do this every day, because most of your benefits also rely on different vendors to help you with that benefit. Come over the counter. Sometimes you could do it online through a catalog, through the phone, or you could go to your local like pharmacy, over the counter store to do that. Some don't actually go into the next month, and it could expire. There are some benefits that have like different dental providers that you could go to, and there's caveats to there. Sometimes they're co-pays or just reimbursement. There's also like your vision, like where do you go for that? What's covered? There's so many little intricacies that I think some people are just like, I give up. I'll just pay out of my pocket because it's too much. So definitely finding a local agent that will help you guide you through the process to make sure that you are utilizing all your benefits. I've had instances where I've met people where it's been years and they've been actually going to their dentist and paying their dentist thousands, and they didn't even realize they had like a $1,500 benefit. And to try to get that reimbursed is like pulling tooth and nail, right? Some people have really bad experiences with filing claims. So things like that, that if someone just know, they could save thousands of dollars. And that's why having an agent through a call center, just not local, may not know most of the plans and how it works. And just having someone that is an expert, that knows what they're doing, and that really wants to help you. Because unfortunately, there are agents that don't really care, don't want to help, make you call the insurance companies yourselves, which is fine. Most people, if they could do that, they'd like to, but why not have that additional benefit where someone's actually going above and beyond for you, like you were their parents and wanted to get you the best thing, or, you know, get you the best service is what I mean. Last thing I do want to note, if you do have a new doctor, a new medical group, I would establish care right away. You don't want to visit your doctor when you have an ailment and, have something rushed or emergency. Nowadays, sometimes great doctors, great medical groups do take up to 4 months to see a doctor to establish care, which is not, it's not all groups. There are great groups that can see you next day, which is awesome. But know that sometimes it could take up to that period to see a doctor, and you don't want that. You do want to establish care right away. Meet your doctor, let them know about all your concerns so they could refer you out to all the specialists. And also keep in mind, specialists too, they are in demand, and you will need to set up the appointment, which could take months as well. So do please be patient with the process on that with establishing care. I know once you have established care with your doctor, then everything does go smoothly because now you're going to meet your specialist. Keep in mind, if you do not like your doctor, you can change your doctor monthly to find the right doctor. Sometimes it's not the right fit depending on what your needs are, and the specialist also to be referred. But I just find that you please empower yourself to make your appointments, to see your doctors, because you don't want to see them when you do have an ailment and when it's too late, right? It's all about preventive care, getting healthy or being healthy, staying healthy. That's really important, I would say, with a lot of my clients that have just retired. Making sure that you want to live the quality life that you want to live, to make sure, once you retire, you're doing the things that you want to do, such as traveling, volunteering, just hanging out. Keeping your mind active is one of the things that a lot of my senior clients tell me. It is a great feeling to retire, but also health is very important. So definitely prioritize yourself, living that stress-free life with picking the right doctors, specialist group, getting those benefits that you need, staying active, going to fitness classes and activities, Also, there's a lot of senior centers with a lot of activities to meet new seniors and so forth. So I really do want to wish you a wonderful year ahead. More episodes to come, and I look forward for this journey with you on Medicare 360. Signing out right now. Thank you, and I'll talk to you soon.